incredibly important to us, and this applies anywhere you work, from nursing home to home health to ED, ICU, floor, anywhere. Respect your RTs, your respiratory therapists. Respect them. Respiratory therapists. They are your go-to. They are going to save your life someday, probably literally, but they're going to save your life as a nurse too.
And your patient's life.
And your patients' lives. You will have stories about how, had an RT not been there, you would have been in big trouble.
Yes. Up the creek.
Yes. So it's kind of going along the theme with kind of this little series that it is respecting their time. So RTs, as a nurse, you have your patient assignment. Well, they have their patient assignment, but it could be all over the hospital. They have, depending upon the facility, various responsibilities from, doing scheduled nebulizer treatments or, rounding on specific patients, and they have to do that in various locations and then respond to codes and then respond to emergencies. So respecting their time is so important because of how many places they have to go and how thin they are stretched. And it's really important that you remember that. And that kind of goes into this making sure that if you think, hey, maybe I need RT, that you troubleshoot as much as possible before calling them and pulling them away from wherever they are to address something going on with your patient. It's not like so this is the person in charge of the respiratory stuff, so anytime there's an issue, I'm going to call them immediately. Like, wait a second, they're desatting somewhat. Okay, are they sitting upright? Are they already on oxygen? Have I already bumped it up a bit? And am I noting their response? Have I done blank? Have I done this? Making sure you're addressing all that stuff first before you're calling them, so that they can, you really are rightfully pulling them away from wherever they are. If it's something that you can easily fix for yourself, it's not really respectful to kind of ask somebody to walk across the hospital to come address something,
Yeah, I mean, you should do that in all of your nursing practices. In general, you should make sure that you're not having a user error at that time.
Yes.
Did you turn it off and turn it back on?
Yes.
Yeah.
Did you try atropine?
Yeah.
So anyway, sorry, off topic. So I do think that like changing the pulse ox position,
that's a
different
big
pulse
one.
ox. Double check that your monitor's working. I don't know if you guys have this, but we have pediatric pulse oxes. I grab those every time I
the
can't
little
get a good
stretchy
reading.
ones, those are wonderful.
Yes, because I want to make sure I'm getting that reading before I ask anybody for help. Unless, of course, your patient is cyanotic, blue in the face, gasping
don't play
for
around
air.
for too long.
You're not like, let me double check. No.
Be a clinical,
Right.
Be a clinical nurse. Just
Yeah.
be a clinical nurse.
Use your critical thinking, but if your patient looks fine and their O2 stat's kind of off and you don't have a good waveform, then, make sure that you're making sure that it's an accurate number with an appropriate waveform. If it's on their finger, their hands are nice and warm, they're not freezing, that
Put
kind
it
of
on
stuff.
their earlobe, or some of them go on the forehead.
Yeah.
Along with respecting their time, one of the first things I like to do when I get onto a shift is I call RT just to touch base. If I haven't seen them on my floor yet, I'm not sure who's on, I'm going to call them. I'm going to say, hey, bed 4 has a CT, let me know what time works for you, just so they can plan their day. Because they have to do some of that stuff. At our hospital too, they made, unless a patient had an ART line, they had RTs draw ABGs. Let them know which of your patients have ABGs, because it's not really their job to look up who has a CT. It's your job as the nurse to coordinate getting to CT.
And communicate.
Yeah, and that's going to take up 30 minutes of their time. It might pull them away from the other tasks they have. They're going to have to find somebody to cover their nebulizer treatments at 4 a.m. So just respect that, you're not the most important person in the hospital. I mean, the patient is, and you coordinate the care.
Right.
Beyond that, let's respect their knowledge. So think about this. RTs spend 2 full years, 18 months, 2 full years or whatever, learning just about the respiratory system. That's it. We spend a month, probably not even that, a couple weeks in nursing school going over the lungs. And so they kind of know what they're doing. They're actually really, really good at this stuff. And so respect that knowledge.
And ask them for it. Say, please educate me on Veni masks, on why I would use a non-rebreather versus any other kind of mask. Why would I use a nasal cannula? Teach me about the settings on the vent, because I know I didn't learn that in nursing school.
If you see them dinking around or hear them pushing buttons in there, run in there and be like, What's going on?
Yeah,
What'd you change?
why are you doing that?
Yep.
Yeah, I think it's really, really
Like,
important.
why? What made you make that call?
And I've yet to run into a respiratory therapist who doesn't want to educate the nurse around them,
Yeah.
because I think that to them says, whoa, my job is about to become easier because I have another team member who's on
Who
board,
knows?
in the know, in that circle, because it's helpful. So you want to know it, and they can help you with it.
And that little bit of knowledge, not knowing a lot of it, but knowing a little bit of it, puts you in more of these multidisciplinary discussions where you can take a problem to an RT, then you both can take it to an MD, and you guys can start building a care plan for a difficult septic patient or something like that.
Yeah, it's really, really important to just respect them and their knowledge base. It's not like I am the nurse and I have my RN and I'm in charge of everything and I know everything and these other people just help me. Like, that's not how this works. Like he said, they go to school for 2 years. We're learning one system. Like, imagine just how vast that knowledge is, and we really have to respect it. And if we don't know something, it's fine to say, hey, I don't know blank. Can you explain this a little bit more so I can understand it and better take care of my patients?
The only NCLEX question you're probably going to get on vents is going to be vent alarms. So that's all that we're really kind of expected to know before we become a nurse about vents is vent alarms. So you really just know, it's your job to know your vent, even if you're not ICU or ED where you're with vents. On the floor, you're going to see BiPAPs and CPAPs and stuff, and you need to understand positive pressure support. We have some great posts on that too. If you Google BiPAP versus
Yes,
CPAP,
it's a really good
Yes.
post.
you'll see that, and that will give you a nurse's knowledge. Like, it's me talking about it, so it's not what an RT knows. Like, an RT knows way more than what I explained there, but it's gonna get you to where you can talk like an intelligent nurse to them.
Yeah, so I actually wrote the section that we did on our lab course on ABGs, and I'll be very honest with you guys, I didn't know barely anything. I knew the lab values. I knew how to sit and look at a problem and figure out if they're acidotic or alkalotic or however. But I didn't really understand what it meant. And I sat down with my RTs and I'm like, I really need you guys to help me out with this. I was blown away by how easy, I had so many aha moments. Like, why are we not having RTs teach our respiratory sections? That needs to happen.
Yeah.
They're so awesome, so knowledgeable.
They're cool. Like, they'll print out the ABG, they'll look at it and go like, all right, I'm gonna bump up the PEEP to 10.
Yeah, they
like,
already
that's
know.
it.
Boom.
How'd you,
Let me just
back
look
it
at
up.
that
How
for
did
a
we get
sec.
there?
Yeah,
Yeah.
I agree.
Yeah.
oh, yes. That's a good call.
I
Yeah, I
would've
would
done
have
the
said the
same
same
thing.
thing.
Yeah.
Like, they're awesome. Like, I just can't stress enough. I still know all my favorite RTs, you know, at my first job and stuff, because like they're awesome, you know.
The best ones, and I feel like most of them are. I don't know any frantic RTs, but they're so calm.
Yeah, it's like, all right,
because
I'll do that.
they deal with codes all the time.
Yep.
Because they go in and they are responsible for the airway, and they know that, and it's wonderful when you have just this very knowledgeable RT that is very calm, cool, collected, and I feel like all of them are that I've run
My
into.
first time disconnecting a ventilator, you know, tube as you're moving patient around, like it'll pop off sometimes.
Yes.
I'm like freaking out, and they're like, all right, pop it
Yeah.
on, and we're like,
Yeah.
oh, it's that easy.
Oh
All right,
yeah.
cool, cool.
Yes.
Yep.
Anyway, let's.
But wait, one
Okay.
very, very important thing though is remember they are part of your team, and it's important to make them feel like that. So learn their names, learn who they are, learn about them. You know, when you've got potlucks going on, include them into stuff that's going on in the unit, because you know what, they're just another important part of the team.
Very important part of your team. Yes.
And it's really fun to see them, like, because I had some that I kind of started at my hospital at the same time. Like, they had just finished RT school, I just finished nursing school, and so we both saw each other getting taught, you know, as we were going. And then the one guy, I remember him, he was awesome, Marcus. He moved over to the NICU, the neonatal ICU, and then a couple months later I saw him back. I was like, what's up, man? Like, it was really nice to reconnect and see how his knowledge had built and my knowledge had built in different ways, you know, and then we were able to kind of work so close together and just really, like, I love RTs, you know, I say it so much, and like, I just, you can't be an ICU nurse without an RT. You just can't, it's
Right.
impossible to do.
You can't do ED without
not?
RT.
You
period.
can't be a nurse
just
in the
can't.
hospital really without loving your RT.
I just don't know those
Yes.
other areas, but yeah, I can't imagine like trying to really manage a BiPAP and everything really well for a patient,
Yeah.
or even give nebulizer treatments or any of this stuff. Like, you just need them.
So RTs, we love you.
Thanks.